Hi, my name is Jessica, and I am a therapist here with Healthy Futures. We have, of course, had a few patients come in to Healthy Futures with an additional diagnosis of Autism Spectrum Disorder, and so I just wanted to kind of increase my knowledge around that. So I did a little research and wanted to share that with the team. Some of the things that we know and that obviously we're supported by some of the research is that some of the similarities in the way that both autism and eating disorders present themselves can kind of make them either work together really well or against each other in that sense, whereas there's both a lot of rigidity, a lot of certain patterns and structures that we see in both. And so that can make it really challenging to create a flexibility in meal plan or timing or variety and things like that. So that's one of the challenges that we see that matches with that. A little bit of the research that I found is showing some of the sources of some of the symptoms and behaviors in autism in particular in the brain, which is fascinating and is hopefully going to be really helpful in the future. They found a lot of patterns and brain pieces that they're starting to see in across the board with autism. So one of the things I found interesting was that the brain development in that first year of life, the early stages, in year 1, is a lot faster in those with autism. And so unfortunately, their brain is growing too fast in their first year of life. So it's they may have same head sizes or even smaller head size, but their brain is trying to almost press out, and it just grows too fast, and it's like too much material without the years of experience, like being able to talk and walk and interact, to go with it. So what the brain does with all that growth, and it like needs to do something with it, it creates perhaps some incorrect pathways then, because it's growing and you're not even 1 yet, so you can't quite walk and talk maybe. So it has to go somewhere, and so the information creates some incorrect pathways, which is then, that's a part of what they're gathering as autism. This is that comes out then in some of these behaviors, food pieces, and relationship, social connection issues, is that the brain kind of created this setup that didn't serve very well later on. So a lot of the traditional treatment for autism is occupational therapy, so behavioral therapies, that internal sensory motor work that they do, feeding therapy through with an occupational therapy setting, social interactions, of course behavioral therapists. So all of the similar treatment approaches that we might use, say CBT, DBT, can be very effective and helpful, but we are finding that it's a little less effective because of some of the brain patterns and the neural pathways that were created. So even CBT being just not quite as effective. That's shown by one of the characteristics of autism is it's that repetitive behavior, kind of being stuck in a cycle. So it's very hard to kind of change that. So it's just maybe takes that little bit of effort and a little extra work. So some of the things that we see that work and that create the most effective results that we can, especially at this setting, at like the IOP level of care, some very clear boundaries, some very clear rules, and then following through with those rules. Specifically when we have a lot of challenges around changing food and meals and meal timing and all that, is one of the ways that we can start our focus is just increasing what we already have. So increasing a quantity of something that we are already eating. And then we can work on variety, but maybe that first step is creating a comfort with what is known. And that matches the treatment approach that we really like and do here, is to create a reduction in the anxiety and creating calmness and a comfort with a little bit of growth and challenge. And then we kind of expand that zone of what we can challenge, and then create comfort in that, and then expand that a little bit further. So it is a slower process, but we we kind of know those little areas, and we just kind of have to move slowly with it. And I'd say we, at the IOP level here, we, have at least 2 out of 50 in an IOP level programming. And then what we're finding interesting is, like in our adolescent programming, we're seeing a rise in the diagnosis ARFID, avoidant restrictive food intake disorder, and I would say a higher co-occurrence of autism or autistic symptoms presenting with ARFID in particular, which matches because it's a sensory originated type disorder that has gone to that level where the food is a clinical piece and the nourishment is needed. Right. And so, as with everyone, we hope to create something that's fairly customized and individualized, but what I hope this helps, and what I think I gained from doing a little bit more research in this, was to see some of the specific areas where I can individualize with someone who's also struggling with autism and the food body weight pieces.